Now for the next gene therapy drug we should be looking at is what is known as an Exagamglogene autotemcel. So this goes with a brand name known as a Casgevy. Exagamglogene autotemcel goes to the brand name Casgevy. So for what we have here, we said that the Exagamglogene autotemcel is a CRISPR-Cas9 based autologous gene therapy, and it's mainly used in treating sickle cell disease and also what beta thalassemia that has affected the person so much that the person is literally dependent on blood transfusion. Okay, so class and mechanism of action is an autologous gene edited cell therapy. Technology uses the CRISPR-Cas9 genome editing. So target it to actually enhance a gene known as a BCL11A gene, okay, in the hematopoietic stem cell. Okay, so how does the drug work? We said that the patient's stem cells will be harvested and be taken out. It's usually done in the lab, so the CRISPR-Cas9 will now disrupt what the BCL11A erythroid specific enhancer. Okay, so this will now reduce the BCL11A expression, okay, which is a repressor of what fetal hemoglobin. So edited stem cells will now be reintroduced back into the body of the patient. Okay, so engrafted cells will now be producing red blood cells with high fetal hemoglobin levels, which will now prevent sickling and to compensate for what defective beta globin. So this is how this gene therapy works. So pharmacokinetics is a single intravenous infusion. Okay, so they usually infuse CD34 cells after conditioning. Distribution: edited stem cells will go into the various bone marrows, okay, and blood will be produced, and it has a high level of fetal hemoglobin, okay, and there's a long-term expression of that. So durability depends on the stem cell engraftment, okay, how much of the edited stem cells have actually gotten into the bone marrow. So therapeutic use in treating sickle cell in patients that have gone above 12 years, transfusion dependent thalassemia in patients that are also above 12 years. Okay, so clinical impacts: most patients will achieve transfusion independence, like they will no longer need transfusions due to all those due to all those crises. Okay, so adverse effects can cause cytopenias, can cause mucositis, can cause febrile neutropenia.